Welcome everyone to today's program, which is brought to you by Ambulatory Alliances. I am Robert Kurtz, moderator for the webinar. Today's program will begin with a roundtable discussion between our panelists, and then we will have a question and answer session following completion of the roundtable. You can submit any questions you have throughout the webinar by typing them into your control panel in the space labeled Enter a Question for Staff and clicking Send. Our panelists will attempt to answer as many of your questions as they can during the Q&A portion of the program. It is now my pleasure to introduce today's panelists. We have Blayne Rush, President of Ambulatory Alliances. He is an SEC registered and FINRA licensed investment banker. He specializes in ASC brokerage, ASC turnarounds and increasing ASC valuations through physician recruitment and syndications, and access to the capital markets and capital structuring consulting for surgery, urgent care, and radiation oncology centers. We have Kurtz Bernstein, who is Managing Director for Altegra Health. Mr. Bernstein specializes in providing valuation, transaction advisory, strategic and operational consulting services to clients. He has extensive experience working closely with hospital systems, physician groups, ambulatory surgery centers, and other healthcare providers. We also have Stephen Goldstein, a shareholder with the law firm of Tierney. Steve has been representing healthcare providers for over 25 years, with special emphasis on the business and transactional needs of physician practices and other providers, including surgery centers, sleep labs, urgent care centers, imaging centers, and medical billing companies. We will now begin the roundtable discussion. I'm going to ask Blayne to start us off with his thoughts on this question. Blayne, who is buying urgent care centers, and what are they looking for in an acquisition?
Yeah, thanks, Rob, and I appreciate everybody taking time out of their day to join us today, and I appreciate the other presenters taking time and being involved in this. Investment bankers, we refer to this as the buyer universe, and typically speaking, we can break the buyers or the investors down into 5 buckets, if you will. There's hospital health systems, there's consolidators or management companies, and then you have financial sponsors, payers, and physicians or physician groups, and we lump those into 1 bucket, if you will. So you have the hospital health systems, and as we all know, there's been a war going on for primary care in most markets, as well as a rush to create strategic alliances with referral sources and gatekeepers. And with the emerging urgent care market, hospital health systems are very active in pursuing those relationships and transactions. And I foresee what we have seen in many of the other outpatient markets, and that is a game of tug-of-war that's going to happen between the hospital health systems and the management companies. While we're not there yet, some hospital health systems are further along than others. Hospitals are looking to expand their market by putting flags in the ground, staking claim to their growing market territory, if you will. A lot of these guys are going further and further out. And they're looking for access to patients in their revenue streams. With urgent care centers, this is an opportunity for those guys to align with the gatekeepers as well as put flags in the ground all around their competitors, all around their markets. So in hospital health systems, both large and small are looking for centers that are positioned in strategic locations, as well as they are seeking busy urgent care centers that have a very solid management system and a model that they can replicate in their market. This is a new business for many hospitals, as they want that expertise that will be able to help them grow that business. Similar to what we'll discuss when we speak about financial sponsors and platforms, if there are multiple centers owned and operated by very respectable physicians, hospitals are going to be interested. I mean, while there's a lot of smaller transactions, the larger recent health system transactions, you know, Dignity Health bought the urgent care center, US HealthWorks, last year. And then you got the management or the management companies or consolidators, if you will. Urgent care center management companies, for the most part, are looking for centers that they can improve by increasing its revenue and profitability. They also are interested in centers that fit strategically, be it in location, some proprietary software, some marketing program that they think is really, really neat and that they could put out amongst their other centers. And they're looking for scale, such as, say, a multi-center transactions. Most of the larger management company, they have some sort of financial sponsor that they need to satisfy from a growth standpoint. either same-store growth, acquisitions, or through development. If a company needs to show growth, they'll, they might be interested in a center that has great cash flows, but not necessarily a lot of growth potential. They're in that case going to buy it for the cash flow, which shows financial growth within their portfolio. It also looks good to Wall Street if their money guys are on Wall Street, or their financial guys and on their financials. Most urgent care center management companies, they have an equity position, so I'm not really referring to their franchises. And so those equity positions typically a majority interest or financial control interest. I believe we'll start to see many more ownership and management models form over the next few years as the industry develops. This is the same evolution that we've seen in other outpatient businesses or ambulatory services market, if you will, as such as ambulatory surgery centers, radiation oncology, etc. You have the Next Cares, the CareWells, Patient First, CareSpot. You have MedExpress, American Family Care, and there's a few more of those guys out there. That's just to name a few. And then you have the financial sponsors. We also refer to those guys as private equity or PEGs, if you will. They're interested in emerging markets where they can capture growth. And the private equity groups are positioning themselves to capitalize on this growing urgent care market. The data shows that the private equity firms invested somewhere around the lines of $4 billion in health and medical services in 2012. That's an increase from about $3.5 billion in 2011. And back in 2009, it was about $1 million. So you can see that there's substantial growth in the healthcare, and urgent care centers are an attractive investment opportunity. Many private equity firms are seeking to capture this opportunity by acquiring a well-positioned group of clinics or centers, if you will, and then grow their investment through consolidation of smaller regional players or specialized players, and also by starting with a platform company that will also grow through de novo growth. So you have a fair number of private equity groups who are looking for that initial platform acquisition. They're looking for an urgent care company that owns and operates multiple centers, one that has a strong management team in place. And let me take a step back real quick for a second and speak about private equity. And so we can understand or better understand financial sponsors and how they function, or better yet, the whys. This is typically speaking, so obviously there's some differences out there. But PEGs get paid on a 2 and 20 basis. Their investment fund life is 10 years, and the typical investment is for 6 years. They get paid 2% of the amount that's under management and 20% of the up, or the growth, if you will. So they typically have 4 years to invest the money for the remaining 6 years. Then they'll either flip the business to another fund that they have under management, or they'll sell it to a strategic, they'll sell it to another financial sponsor, or they'll go public. They have many businesses in each fund typically, so they have this, this fund that has, 5, 10, 15, whatever companies within it. And so they take a portfolio view of investment, and, how is the entire fund performing, not just one company. And they look at businesses with at least $1 million or more in EBITDA. But that $1 million, understand, is at the very low end, and that it's going to go to a smaller fund. The larger the EBITDA, the more attention that you'll get. When you start getting above $2 million in EBITDA, and when you hit $5 million, you'll get a decent amount of attention from a lot of the PEGs, as long as you have the other desired attributes. But again, at $1 million and very attractive attributes, you'll get some looks. So the management companies, for the most part, are more focused on the single centers or small clusters, not to say that they will not be interested in the larger multiple centers deals or other management companies, because they will. But the distinguishing factor is that financial sponsors are not typically interested in single centers. They're looking for bigger ones, as I said, that can create the platform. Additionally, because financial sponsors do not have market expertise, they're looking for a management team that's in place that they can invest in. If your business is very attractive, but your management team needs more than financial support and strategic help to grow, Some of these private equity groups have what's called residents in waiting, which is essentially an industry expert that is on the fund's payroll, and they can put that person in as the chairman or the CEO or some other high-level leadership position. And some of those examples of those transactions, Brockway, Moore and Partners, they invested growth capital in the MD Now Medical Centers. That was last year, I believe. Capital Group Holding, I believe they're actually a public company, so it's not actually private equity, if you will. But they invested in Alliance Urgent Care. Then you got Ridgemont Equity Partners. They took a majority stake in Hometown Urgent Care. Then you have LL Partners and WellPoint, which is an insurer. They came together and invested in urgent care clinic chain Physicians Immediate Care. And then you have physicians as buyers, which are typically looking to buy a job or a business that they can take and expand. The typical profile of center would be a center that's generating little or no profits that they can buy outright and use an extension of their practice, if you will. So in other words, just grow their practice a little bit or move their practice over. Current owner operator that needs to relocate or sell their urgent care center quickly, that's a good target for those types of guys. The concept of payers owning urgent care or ambulatory centers, for that matter, is not new, but it's becoming more prevalent and more active. The reason that payers are looking at urgent care is to secure the lowest cost for services possible. They're looking for operational efficiencies and cost savings. That's the goals. Humana, they acquired Concentra a couple of years back, and then again, like I just mentioned, LLR and WellPoint has invested in some urgent care centers. So I also think that it's not a stretch that in the future we'll see more employers or groups of employers owning these types of centers. Especially the self-insured guys. They're looking for the same reasons that the payers, operational efficiencies, cost savings. They're also looking for workforce efficiencies.
Thank you, Blayne. I'm going to ask if Kurt, Steve have anything they would like to add. All right.
Just
we can
real
move on.
quick. I mean, not really much to add there. That obviously was great depth. And as Blayne said, the payers are in the hunt. Humana buying Concentra and LR Partners and WellPoint coming together for this Physicians Immediate Care. It's really interesting just to see these chains. Concentra being the largest, 6 maybe having over 50 centers. It's a really fragmented industry. There's over 50% of all centers are just one-off centers, and even these larger chains are all over the board. Convest Group and Blue Cross Blue Shield in North Carolina came together to buy FastMed or develop FastMed. And they have centers in North Carolina. Obviously, Blue Cross Blue Shield in North Carolina being North Carolina, but then they also have centers in Arizona. So you never know who the buyer is going to be. I guess across the country, it seems like there's a lot of buyers out there willing to invest in different markets.
Thank you, Curtis.
And I would say, following up on that, you're seeing a general trend in healthcare overall, not just in urgent care centers, but in everything in terms of consolidation, and I think you're going to continue to see that certainly in urgent care centers when you have these scattered centers or you have these one-offs. I mean, there's going to be the continued trend, as Blayne and Curtis just talked about. That's a trend and a pressure throughout the healthcare industry, and certainly will have that effect in urgent care as well.
Excellent, thank you. I think that transitions beautifully into our next question. Blayne, more or less buyers currently than in the past, and why any change?
We can look at it this way, and the industry is poised or positioned very well to continue its aggressive growth. It's expected to increase from somewhere around 9,000 centers, depending upon what centers you consider urgent care and count and all that type of stuff. With about $13 billion in revenue last year, it's projected to grow to about 12,000 centers and nearly $18 billion in 2017. The rate of growth is mind-boggling. you know, they're going to go from somewhere around 300 a year to over 600 a year. That's somewhere around 2 a day if you do the math. And a lot of the factors are driving this growth. You know, we've got an aging population. Obviously, they're going to increase demand. It's growing population overall. Everybody talks about it, shortage of primary care providers, ER wait times, and then the low startup costs compared to a lot of other businesses. And then you have, for the most part, across the U.S., minimal regulatory constraints, and I know Steve will talk about that a little more in depth in a few minutes. What's not spoken about very much is that we're becoming a very now population. We don't have the same primary care relationships that our previous generations have. We want to walk up, walk in, you know, get it done and walk out. And urgent care is well positioned for that. And with the advent of personal health records that we can carry on our phone or iPads, whatever, and us looking at the relationship again with our primary care doctor differently now, I mean, all that stuff's evolving. So this market is expected to see continued substantial growth. Many experts are touting that the Affordable Care Act will introduce 30 million newly insured patients to the market beginning next year. While I'm very bullish on the market and the growth, I believe that it's very possible that we'll see less insured patients in reality. But either way, urgent care is a winner. That's what we're seeing, and we'll continue to see more and more buyers and more money come into the market. Urgent care, like Kurtz was referring to, is a very fragmented market with many businesses having, again, 1 to 3 centers. So it's all over the board. With this type of growth and with that much fragmentation, we're going to see a huge influx of buyers or investors, if you will. We're seeing many more buyers, and we'll continue to see different ownership models as the market evolves. So it's exciting times. It's exciting to be in the urgent care market at this point in time.
Thank you, Blayne. Kurtz, Steve, anything you'd like to add?
Yeah, this is Kurtz. Real quick. As Blayne said, we're seeing definitely a growth. Looking at 600, Urgent Care Association America projecting 700 to 800 facilities opening each year. And we'll talk a little bit about the Affordable Care Act later, but obviously with the exchanges and ACOs and Medicaid expansion, it is possible we're going to see more and more insured patients, and one reason Humana is looking at purchase Concentra and the other payers are looking at urgent care centers is because the cost of going to an ER right now, if you're unsure, you'll probably walk into an ER or the urgent care center will direct you to the ER. The average case might be $600 versus $150 for an urgent care center, and those payers, want to make sure that they're providing the best quality of care at the lowest cost, and obviously reducing the cost helps improve on the plan side. They keep more of the premium, and therefore they make more profit at the end of the day. And that's why you're obviously seeing more and more private equity money going in here, because they are bullish on the fact that the more patients and insured patients are going to start coming out to these centers, and that'll result in increased revenue, and you have pretty much significant fixed costs, the building and the bed. Then you have your physicians, and the incremental patients will just lead to more and more profit for the investors.
Thank you, Kurtz. We'll move on to anything else to add? Okay. Move on to the next question. Kurtz is going to stick with you to take the lead on this one. Explain how acquisition price is determined.
Sure. There's no real magic to this. In the first question, I think Blayne covered a lot of it. It's really what are the buyers looking for. If they're looking for a large an organization that owns a number of different centers and have the policies and procedures in place to operate efficiently, producing good quality of care. Obviously, with the whole triple aim that came out a number of years ago, the idea is to manage the health of the population at the lowest cost, and so that's why urgent care centers are going to become important. as we're really moving toward those models and the new payment models, which we'll talk about in a little bit. But ultimately, just like any other industry, it's a multiple of earnings and what kind of profit can you get out of the center. So, a single center, as I mentioned earlier, you have a significant amount of fixed hard costs there, whether it's the building, the beds, everything else. And as you're able to see more patients and have the capacity to see more patients, you create more earnings. And then as you add more centers to that entity, if you have, as we mentioned earlier, over 50% are one center, people owning one center or companies owning one center, up to 3 centers. It's about 70% of all urgent care centers in the market. But as you add more centers, you get up to 3, and then some of these larger companies, even the larger companies, have only like 30 or 40. Concentra being the outlier here at over 300, and U.S. HealthWorks at about 150. But as you add those more centers, obviously you create more profit. And if you're in the market, if you have the possible physician leader, as Blayne had mentioned in the first question, that can roll out the ability to use the urgent care centers effectively in managing the care of the population and moving the patients out of the ED and growing that actual business in each market, that's obviously an important factor in coming up with these acquisition prices. And then, they've traded generally in that range, similar to other ancillary services, whether it's the 7 and 8 area. And, as you see bigger centers, we've seen higher multiples. It really just depends on what you can do ultimately with the business that you're acquiring. And, with the pegs that are out there, the private equity groups that Blayne was talking about, obviously they're looking for the higher growth in earnings and profit.
Thank you, Curtis. Blayne, Steve, anything you'd like to add?
Yeah, this is Blayne. Obviously the investment bankers, their role is to go out and make markets. And, Curtis outlined some of the science behind the valuations. And what people need to understand is there's an art to influencing that science. Some of the things that people are willing to fight over, meaning that they're willing to get in there and get competitive and bid up against each other and run the numbers up somewhat. If you have some novel processes, one of the things some of these urgent care guys that I'm been speaking with is that they're creating these proprietary electronic medical record systems that go across everything that they do in there. I'm not an operator, so I don't understand all of that type of stuff, but I just know that some of those guys are developing that, and they speak as if there's very little options out there. So if you have that and it works well, if you have a marketing program like we spoke about, that increases the interest, and by increasing interest and having more options, you're able to push those numbers up a little bit. Buyers have compulsions. They have reasons that they have to buy, and they have to buy now. And if you can get, we talked about that use it or lose it money, or let's talk about that for a second. I mean, some of those guys out there have to show growth, and if they say that there was 4 companies going after a deal last week, well, typically speaking, at least 3 of those are going home empty-handed. So if all 3 of those guys spent 9 months of their lives chasing some decent-sized deal, and here they are, they're going home empty-handed, they're scrambling for a deal. I mean, I've had many people call and said, hey, I need a deal, and I said, what does the deal need to look like? It just needs to have EBITDA, because they need to show growth to their investors or whoever that they're proving their growth up to. So and those types of things will drive the numbers up, because in the real world, transactions, buyers and sellers have compulsions. And I get the definition of fair market value and all that type of stuff, but nonetheless, and the same thing, if investors have a Southwest footprint and want a Midwest footprint, they'll be willing to pay a little more for a center in the Midwest compared to identical type of center in the Southwest. Thus, having multiple buyers that have multiple compulsions and multiple, things that are driving them to do something now will allow them, they'll want to lower the internal rate of return. So again, the more options you create, the higher prices that you can typically get for your business.
This is Curtis. Go ahead, Steve.
Yeah, this is Steve. I was just going to say, so Blayne mentioned a little bit about fair market value, and we'll talk a little bit more about that. But that certainly is part of how the acquisition price is determined, depending upon who the buyer is. And in the urgent care center market, it's a little easier to deal with because you do have so much activity and so many other comparable sales that don't include people who are necessarily in a position where the government would look at them as paying for referrals. So it is a little easier to deal with the fair market value issues in that kind of market. But it's clearly something that has to be part of any kind of analysis of how the acquisition price is determined.
Yeah, and it's Curtis, Steve. That was pretty much exactly what I was going to say as far as fair market value. You know, you're not always restricted to the fair market value standard if the buyer is not is a for-profit, is not a not-for-profit, and the seller may not be in a position to refer, may just be a businessman that owns urgent care centers. And we have health systems out there that buy clients that are buying urgent care centers without even the need for evaluation. From a legal standpoint, the lawyers are comfortable not getting that opinion. But also to something Blayne said, and one of the most interesting things we've seen, and this kind of comes down, we're going to talk a little bit about the Affordable Care Act later, but with accountable care organizations and IT systems, is if we have one client that's actually developed an IT system where if the patient presents to an emergency room within a certain health system, which the organization has physicians on their medical staff, it's actually a physician-led organization, that the program that works with the systems in the hospital to say, this is a patient of that practice, and then that patient goes over to the practice's after-hours urgent care center instead of actually being seen in the ER, as long as it's obviously a treatable condition. If they broke their arm, or if it's not a major condition that has to be seen in the ER and be stabilized right away. And it's those kind of things out there that if a seller has those and a buyer can purchase it and roll it out across the board to different areas of the organization, it's obviously worth a lot of money, not just from an investment value, but obviously from a fair market value standpoint. Because when we even look at the fair market value standard, we need to say, okay, well, what could any hypothetical buyer do with this, and who would want it? Who are the likely buyers of this business? And because this business has that, it might be a company that could roll that out to a lot of its different organizations and be very beneficial to those potential buyer universes.
Excellent. Thank you all. We'll continue moving on. Blayne, if it was back to you to start discussion, and we already sort of started touching on this with the last question, but discuss a little bit further, multiples of earnings, up or down?
Great question. It's a question that most people want to get answered first and go home. But I'm a market maker, and so I disclose that I'm biased because I get paid to drive the multiples up. Now that I put that out of the way, we've discussed the urgent care center market, and we've discussed it as an emerging market. It is growing, it's attractive, so it's very attractive to investment opportunities regardless of what happens to the payer system, in my opinion. And private equity firms have invested $4 billion in, like I said, in health and medical services, including urgent care in 2012. That's grown substantially from 2009, and a lot of that money is going to the urgent care market. And when there is money to be spent in a market, or money is flowing into a market, prices rise. Simple economics. And because, again, this is an emerging market, and I get that urgent care has been around for 30 years, but it's different now. It's an attractive market for investors. There's more buyers chasing the deals as the multiples are going up. A few reasons for that. The multiples, and I know Curtis touched on this, but the multiples all over the board, depending on what the profile of the business or the centers look like. They go anywhere from 3 to the double digits. And obviously, the lower numbers are the single centers with not a whole lot of efficiencies. Maybe 1 or 2 center transactions that aren't marketing themselves very well to buyers, or they have some strong risk factors. And those double-digit numbers are for multiple center management companies, whenever they have double-digit centers, 15 centers, 12 centers, somewhere along those lines. And then you're still seeing very good numbers for the 4, 5, 6 centers transactions out there, especially if they have something special, something novel that we were speaking about, or they have some great leadership teams in place that, because I've seen transactions happen where they have an organization that has 15 centers and their management team is not as good as a management team of, say, a 4 or 5 center. So they're going to go and look at that 4 or 5 center in a different light because they're also, quote unquote, buying that expertise as well through contracts, meaning through employment contracts and agreements where that management team agrees to come on board, those types of things. So if you remember what we talked about private equity groups, how they get paid, how they look at businesses, add that to the high rate of growth in this market and you get those high multiples. And we talked about, Steve talked about these different types of buyers, some that aren't under the confinements of fair market value. Well, this rising water, rising tide drives the prices up as well for hospitals and these other types of buyers as well. And so the buyers run those numbers up a little bit, and they believe that over time, because it's emerging market, if they pay a little bit more than they really wanted to, then they think they'll make the investment up over a short period of time. And additionally, we have a market where more buyers are trying to get in, meaning that they've not been in this market, and essentially they have to buy their way into the market in order to obtain a platform. So all that drives the multiples up. So obviously, I've said it over and over again, the multiples are going up.
Thank you. Either Curtis, Steve, like to add anything? Okay, we'll move on to the next question. Steve, can I have you take the lead on this? What are some of the regulatory and legal issues surrounding these transactions?
Sure. So let's start at the state level. You've got licensure issues, which is really, that's going to differ from state to state. I think Blayne mentioned that this is not as regulated an area as other segments of the healthcare industry, which is definitely true. You don't see the level of regulation of urgent care centers. In fact, I think there's only one state, which happens to be Arizona, that specifically regulates urgent care centers from a licensing standpoint, that has a separate urgent care center kind of license. You will have outpatient treatment centers or clinic kind of licenses that are required for urgent care centers, or they would be treated as a physician practice if they're, let's say, owned by a physician. And so for outpatient clinics, if there's a license requirement, then there could be a license requirement. In some states, there could be a certificate of need process that you'd have to go through as a buyer. Those things are things you can definitely go through and take care of, both on the licensure and the certificate of need side. They really just affect the timing of the purchase, and you've got to factor that in and give yourself enough time to get through that. For urgent care centers that are owned by physicians, you don't necessarily, you can avoid these kind of licensing or certificate of need issues sometimes, but then you may have corporate practice and medicine issues, and I think we're going to talk about that specifically later on, so I'll reserve that. So those are some of the main licensing issues on a state level. You also have state issues with respect to, let's say, use of nurse practitioners. In some states, you may be able to have a nurse practitioner as the staff person at a center as opposed to a physician. Obviously, it gives you more flexibility in terms of having different providers, having less expensive providers, having potentially more providers available, and that's going to affect your cost structure. That's certainly not permitted in all places, but that's something to consider at a state level. At a federal level, you've got EMTALA issues potentially, depending upon the buyer. EMTALA is the federal statute that requires a hospital emergency room to treat any patient who presents with an emergency condition, and that statute does not apply to urgent care centers. But if you have a hospital buyer, for example, then that could subject the urgent care centers to that statute, and that could clearly affect the operations of the center after the sale, as well as potential expenses that may be incurred in order to comply with that statute. So again, that's a regulatory issue that depends on the buyer. You do have some states. Texas, for one, has sort of a state EMTALA kind of requirement that could apply to urgent care centers, and so you'd have to check on that from a state-by-state level as well. Finally, you've got the federal anti-kickback statute and Stark issues. Those affect a few things. Briefly, I don't want to go into too much detail on these kind of things, but those are statutes that deal with patients who are reimbursed by Medicare or Medicaid or other government-funded programs, federal government-funded programs. The anti-kickback statute is a potentially criminal statute that essentially prohibits the payment of any kind of, the term is remuneration, but essentially any flow of value in return for a referral of patients. The Stark statute is a similar statute, although it's not criminal, and it prohibits referrals by a physician of certain designated health services that are reimbursable by Medicare and Medicaid to an entity in which the physician has an ownership or a compensation interest, unless it fits within a specific statutory requirement. So what you're dealing with here, as it applies to urgent care centers, is that if the buyer is a healthcare provider, like a hospital, or like a physician group, or possibly even a payer, then these kind of statutes may come into play, because you may have then the government's going to look at the purchase price and determine whether any portion of the purchase price can be attributed to paying the seller for referrals, for future referrals going forward. And in order to deal with that, you've got to be able to defend the purchase price as a fair market value purchase price that is independent of any value for potential referrals. And as Curtis said before, I think, in this market, as we've mentioned, and I think as Blayne mentioned, you've got a lot of buyers who are not going to be in a position to pay for referrals, whether those are private equity groups or management firms or things like that, that are really not providers, and so they're setting the market. And so when Curtis says that you can do a transaction without a fair market value opinion, that's unusual in the healthcare industry, and it's primarily because you do have all of these other non-provider buyers out there who are setting the market, and you can defend your purchase price as a fair market value price without having to get that kind of valuation. If your buyer is a tax-exempt hospital or hospital system, then you also have IRS issues because again, the tax-exempt hospital still has to be operated for the public benefit as opposed to private benefit. It can't have any of its earnings inure to the benefit of an insider, and physicians sometimes can be considered insiders for a hospital. And so you have to look at those issues as well if that's your buyer. Those issues, again, go to the fair market value of the purchase price, and are really sort of dealt with similarly as what we talked about with the kickback statute and the Stark law. It's not just the purchase price. If you've got these kind of buyers, and let's say you've got a physician seller, and the physician's going to continue to be working for the buyer after the sale, then you have some fair market value issues with respect to compensation to that physician. These kind of issues also affect maybe earnouts as part of the purchase price. Really, anytime you've got a seller that's a physician, then you've got to deal with these kind of fair market value issues. So those are some of the main regulatory and legal issues here.
Thank you, Steve. Blayne, Curtis, anything you'd like to add before we move on?
Only thing I'd add is, like Kurtz talking about one of these buyers that had centers in, I don't remember what state, or one of the companies had centers in, say, New York and Arizona. Well, obviously those guys have two different ways of looking at what they do. And whenever we do these transactions that cross these state lines and whatnot, we recommend heavily that the sellers are, and typically we represent sellers, is that they engage very competent legal advice early enough in the process to be able to give us a direction of give us some instructions on what direction we need to take the transaction. So I can't stress that enough to make sure that you have good legal advice throughout the process, so we don't end up with something towards the end that ends up killing the deal or causes problems where we can't get the thing closed.
Excellent. Thank you, Blayne. Let's keep moving. I want to make sure we got some time to tackle some audience questions as well. Curtis, going to ask you to take the lead on this one. Most significant trends affecting partnerships with a hospital or another corporate buyer?
Sure. As I've kind of been bringing up time and time again, like I said, there's this thought later even on the Affordable Care Act, but obviously the Affordable Care Act is huge and in a number of ways affecting partnerships both with hospitals and corporate buyers. A lot of health systems are looking to form accountable care organizations, and as part of that, they want to make sure they have all the resources in place to be able to handle the care of the patient in a most cost-effective way. We've seen movement toward bundled payments from not just the government, but also from managed care payers. And obviously with a bundled payment, you want to make sure that you have all the resources, whether it's urgent care centers, surgery centers, diagnostic imaging, and trying to keep the costs down of providing the care with patients. So hospitals are out there looking for these different types of ancillary service lines to make sure that they're directing their patients out of the ER, making sure their waits are short in the emergency room by taking those lower acuity cases and moving those over to urgent care as possible. So obviously hospitals are out there looking, and interestingly, as Blayne had mentioned, we had that big Dignity Health purchase of U.S. HealthWorks last year, and that's kind of all over the country. So even some health systems are out there looking for urgent care entities that, well, maybe in their market, Arizona and California, may also be outside of their market, like Indiana, Minnesota, and New Jersey. You never know where those buyers are going to be. And then, that's also affecting the corporate buyers I mentioned before, the private equity groups and any of the financially interested buyers are going to look for growth and potential higher profits in the future. And the changes in having Medicaid expansion and more people insured through the exchanges is hopefully going to lead to urgent care centers having a higher profit, because it's a significant fixed cost to just start it, and then as you add more patients, you're not really adding significant variable costs, so a lot of that flows down to the bottom line, and those are the things that corporate buyer is looking for.
Thank you, Curtis. Blayne, Steve, anything you'd like to add?
No.
Yeah, a couple things. So the it's interesting what Curtis was talking about. Under the Affordable Care Act, as well as other pressures, industry pressures, is hospitals are moving away from looking at urgent care centers as competition to having incentives to work together. And Curtis mentioned ACOs and bundled payments and things like that. And there's so much importance with hospitals with market share and being able to capture these patients. And so you see these hospitals opening their own urgent care centers to try to expand their market reach, and certainly buying existing urgent care centers can be a potentially much easier way to do that. the other issue that's going on here, as mentioned briefly, is the idea of the physician shortage that's coming. A couple of statistics there. You've got the Association of American Medical Colleges is predicting a shortage of 46,000 specialists over the next decade. 90,000 doctors by 2020. And even a shortage of almost 30,000 doctors by 2015, which is not far away. And so you've got that combined with a lot more doctors retiring for a lot of reasons. And so there's clearly a physician shortage that's coming. And you're going to have patients who can't get in to see their doctor and are going to need a place to go. And, that's been mentioned before, but hospitals are seeing that, and payers as well, is going to continue to motivate them to buy urgent care centers because they're going to face this pressure of having to have a place for their patients to get in and see somebody. So that's what I think we're going to continue to see here. The other issue with respect to hospitals, again, as I mentioned, if you've got a tax-exempt entity that's buying it, you're going to have to deal with those kind of issues as well.
Thank you, Steve. Moving on to our next question, Blayne, I'd like you to take the lead on this. What can urgent care centers do to increase the number of offers they receive from buyers and the value of those offers? I know we touched on this a little bit more, please.
Yeah. To receive more offers, obviously you need to be attractive to more buyers and more buyer types. And as well, you'll have to understand your value drivers and then be able to prove up that value. We discussed who the buyers are for urgent care centers and what they're looking for in an acquisition. Take that information and weave that into your strategy as you grow and expand. And when you start to plan for the exit, you need to really plan for it in a very systematic manner. Do an analysis of your business and really understand it from a historical, current, and future perspective, and then define who would be the buyers and buyer types. And then you want to find out, list out every potential buyer within each of those segments. And then you'll need to take a very proactive approach and go to all of those buyers at the same point in time and negotiate them against each other, essentially. That will take you to virtually every buyer type, and then give you as many options and as many deal structures, because the more people you speak with, the more ideas you will end up with as far as deal structure goes, and you might end up with something or some thoughts that you never really thought about before, and that'll give you access to the best that's in, or the best that's available in that market at that point in time. So essentially, the more attractive you are to more people, the more attention you're going to get, the more offers you're going to receive, and then how you're able to use that to your advantage. How well are you able to negotiate that? How well are you able to extract a lot of information from those different guys is going to play into the answer to those questions.
Thank you, Blayne. Curtis, Steve, anything you'd like to add before we move on? Okay, excellent. Thank you. Again, another topic I know we touched on briefly, want to get to a little bit more. How does the corporate practice of medicine doctrine affect the structure of a sale of urgent care centers? Steve, can you start us off?
Sure. So the corporate practice of medicine is a state-by-state doctrine. It's a pretty antiquated doctrine that basically arose from a time when you had individual doctors practicing medicine, and the concern was that if they were employed by a corporation, that they would serve the desires of the corporation and not the patient, and so states would prohibit corporations from employing doctors. And it was intended to be a way to preserve a physician's professional ability to look out for his patient's interests. It's gone by the wayside in a lot of places, but it still exists in a lot of places, and it varies from state to state. So you may have a state like New York, which has a pretty strong corporate practice of medicine doctrine, or you may have a state like Florida, which doesn't have one, or a state like my own here in Arizona, which has one that I would describe as dormant, where you've got some old case law that hints at it, but nothing really enforcing it for decades, and so you've got plenty of corporations employing physicians. So if you've got a situation here where, let's say, you're buying an urgent care center that's owned by a physician, and you have one of these corporate buyers that are buying it in a state that has a corporate practice of medicine doctrine a restriction on it, that doesn't mean that you can't do the transaction. It just means that you've got to structure it a certain way. The typical way to deal with that is to have a captive professional corporation or a professional LLC that's owned by the physician, by either the selling physician, probably not the selling physician, but some physician who is loyal to the buyer, or it also could be the selling physician as well. And the actual center is owned by that PC, but then there's a management agreement between the corporate buyer and the PC that really has a full control over the operations of the center. You also can provide further protection to restrict the stock of the physician in the PC, have the buyer have an option to purchase that stock, or not directly, but to transfer it to another physician. So there are certainly ways to contractually maintain control from a corporate buyer standpoint while the actual ownership still is in the hands of a physician. So again, this kind of doctrine is a state-by-state doctrine. You got, as Blayne said, you got to really check, if you're doing a multi-state transaction, which ones are affected by this and which ones aren't, and that could require you to have different ownership structures in different states for different centers as part of one transaction. But clearly, it's something that can be handled.
Thank you, Steve. Blayne, Curtis, anything you'd like to add before we move on to our final question of the roundtable?
Yeah, let me add a couple things. I know that Steve knows about this, but it wasn't mentioned. So we're involved with a lot of different transactions across the U.S. So we work in a niche markets across the U.S. and deal with the different states and whatnot, and see virtually all the different models that exist out there. And whenever we get some of these, like New York, we have to get extremely creative in New York, and then even some of the other states. Some of the other people that can own physician practices, if you will, are nonprofits. And I know that we've seen those be created to be able to handle some of these types of issues, as well as, hey, creating the different ownership structures of the equipment versus the facility versus the management agreement, all that type of stuff. So my point is to address these things early on before you actually even go to market, and understand these things backwards and forwards, and at least understand the majority of the options that you'll have, and the creative ways that you'll have to make this transaction happen, and then be prepared for it, because you really don't want to wait to the middle of the transaction or later on to figure this stuff out. So it all belongs in the preparing to sale stage.
Excellent, thank you. We'll move on to the final question of the roundtable. I know we're right up against the top of the hour here. I want to move through this last question of the roundtable, get to a few questions from attendees, and then give our panelists an opportunity to share some final thoughts. So we're going to go a little bit over the end time here, and if you need to leave, we'll be sending an email out with the recording, so you'll be able to catch up on anything that you miss. Final question for the roundtable. Curtis, can I ask you to start our discussion? Again, topic I know was briefly mentioned. How does the Affordable Care Act, aka Obamacare, affect urgent care centers?
Sure, and I think we could probably make this pretty quick, as you mentioned briefly, but I think it's been mentioned here a lot. Obviously, getting patients or uninsured patients historically insurance makes a big difference. As Steve had mentioned earlier, that's going to create a lot of patients. There's already a shortage of primary care doctors. It's going to create an even bigger shortage.
as patients are going to no longer have to go to the ER with ACOs, accountable care organizations. The hospitals are going to try to shift them away from the ER and over to physician practices. And if those physician practices aren't able to get them in, or they don't have evening urgent care hours, then you're going to have to use the local urgent care centers. That's going to drive most likely more volume over to the urgent care centers. We're also seeing the change in reimbursement, as I mentioned, bundle payments and whatnot, and that's going to want hospitals are going to want to drive their patients out of ER, get them out of that high cost, and only use the ER for the necessary cases, and move those little lower acuity cases, medium acuity cases out to the urgent care centers, because that's going to help them keep more of those bundle payments in the future if they do end up having to come to the hospital for any kind of case or whatnot. And you're also moving your reimbursement, not just bundle payments, but the value-based purchasing, making sure you're providing the highest quality of care. And if you can do that, and then more outpatient type setting, we've seen reports and trends that those are being done at a higher quality of care as well. So that's going to help improve, the overall quality of the care provided by the health system. So they're going to want to move that way as well for that reason.
Thank you, Curtis. Blayne, Steve, anything you'd like to add before we jump into the Q&A portion?
Well, I just want to make a clearer statement. I brushed on this earlier, but I believe there's possibly a contrarian view to, hey, all these people are going to be insured, and we still get to the same place with urgent care centers in the sense that I think it's very possible that less people will be insured under the Affordable Care Act because of the rate hikes and the minimal tax, or whatever you want to call it, however they end up designating that, but essentially the penalties. So these younger people that have low penalties but high costs for the purchasing the insurance are going to say, hey, I'd just rather pay the penalty. And that's going to win for urgent care, in my opinion, because it's going to allow those guys to have access to, or they're going to still need access to physicians, and they'll just go to their corner urgent care center for their care.
Excellent. Thank you, Blayne. This concludes the roundtable portion of the program. Got a few more minutes. Again, I want to get to a few attendee questions, give our panelists an opportunity to share some final thoughts. You can submit your questions by typing them into your control panel in the space labeled Enter a Question for Staff and clicking Send. Well, I mentioned we'll only be able to get to a few of your questions. Rest assured that any questions that you submit that we don't get to will be passed along to today's panelists, and I'm sure they will follow up with you directly. Let's get to, again, a few questions before we conclude. First, I'm just going to put out to the floor, not directed to anyone in particular, but have you encountered non-governmental payers, i.e. the Blues, that are not willing to contract with urgent care centers? And if so, what do you see as the reasons for resistance from payers? Does anyone want to take the lead on that?
Well, so this is Steve. So I'll just say there is an issue with sometimes you'll see payers not willing to contract with urgent care centers, and that's, I think, stems from I think times from before where there may have been questions about quality being provided at some of the urgent care centers. In addition, maybe a desire to drive patients in a more formal model to emergency rooms because of contracts they have with hospitals. But I really think that that's changing for all the things we've talked about. There's such a pressure on cost and reducing cost, and the healthcare system sort of gravitates toward lower cost providers. Even going back to the 1970s, where HMOs were the thing then, and so the government, they became extremely favored by the government, and from a regulatory standpoint, were encouraged. You saw that with outpatient surgery centers. as a lower cost alternative to surgeries in the hospital, and those became favored. And I think we're probably going to see that with urgent care centers as well, for all the reasons in terms of access as well as cost. And so if there are payers, I think that are still not contracting with urgent care centers, I think that's a trend that's not going to continue.
Thank you, Steve. Let's move on to next question. I'm going to direct this to Blayne or Curtis to start and see, again, see what you guys think about this. What is the range of EBITDA multiples you're seeing in purchases proportionate to revenue? Reference earlier was made to $1 million versus $2 million versus $5 million as an example. What are you seeing as EBITDA multiples at those revenues? Can you provide an answer to that, or is it too broad?
Well, it is broad, so I'll put some asterisks by it, if you will. So it depends on so many things, and Curtis stated that, hey, the way these things are paid or whatnot, or gave that impression, is on multiples. Well, in reality, that's the way that they're communicated. In reality, they look at it from a future cash flow brought down to present value. So they do a discounted cash flow analysis or some Gordon growth model hybrid, and then they come up with a number, and then they represent it as a multiple of EBITDA. So it has so many things involved that dictate that it's hard to, I would tell you to call us offline, and we could probably speak more specifically. But like I said before, we're seeing numbers from 3 times trailing EBITDA to the double-digit trailing EBITDA. Well, have there been deals that go at 2.5? Yes, but whenever you start getting a little bit lower, you're getting more into the asset value world, or there's just not much profit at all there, and someone needs to get the hell out of there, and that's why they're under a strong compulsion to just get out. And the bigger numbers you're looking at are for significant scale that have something special with them. So there's a transaction that happened. I don't remember if it was 13 or 15 centers, and that went up into the lower mid double digits. So I'm talking the 12, 13x for that type of platform. But it was a significant scale type operations. You start seeing better, and the smiles start getting larger on people that are selling that have, say, 5 centers that are very efficient, that have a good model, that someone wants that model in management company as well, because those guys are looking to grow to 7, 8, 9, 10, but someone comes in and says, hey, you're very attractive to me. I'm very attracted to you. Hey, let's talk. And then that gets people to thinking, and then, hey, let's go to market to see what this really is and just test the market. And so those numbers, you're starting to see larger smiles, meaning the numbers are going up. When you're the 3 centers and below, you still get a decent number if you have 3 centers, if they're positioned right. But whenever you start getting to the 5 and on above is the real good numbers. Whenever you get to 15, everybody's fighting the streets over you, and which all that equates into the higher multiples, is my point.
Thank you very much, Blayne. I'm looking at the time here, and I don't want to keep us running over any later. I want to give our panelists an opportunity to share some final thoughts in a moment. I want to certainly, again, let everyone know who took the time to submit a question we didn't get to. Again, their questions will be passed along to our panelists. I also want to direct you to their our panelists' contact information, which you see up on the screen right now. Certainly encourage you to contact each of our panelists, all of our panelists, directly if you have any questions for them specifically, or feel free to reply to any of the emails you've received about this event with questions, feedback, or even requests for topics for future webinars, and we'll make sure that that information is passed along to the right people. With that, again, I want to give each of our panelists an opportunity to share some final thoughts before we conclude. Steve, why don't you kick us off?
Sure. Well, I think this has been a great conversation, and I wanted to say thank you to everybody for participating, as well as all of the people who have been listening. And I can't say enough what's been emphasized about the urgent care center market and how it really has the potential to explode, the healthcare industry as a whole, I think, is changing significantly, and the reimbursement models and pressures on cost and all of those factors, the increased integration, all of those factors really point to the continued growth of potential transactions in the urgent care center market. So I'm sure that this is we'll see more of the kind of conversations we're having today. We'll see more of those to come. And so thank you again for giving me the opportunity to participate.
Thank you, Steve. Curtis?
Sure. As Blayne said earlier, obviously it's pretty exciting to be in this market right now. There's a lot of opportunity with the stuff coming down from the Affordable Care Act, and I hope everyone learned some stuff today. I know I have, listening to Steve and Blayne. They're definitely experts in this field, and I just appreciate the opportunity to be on the panel, and feel free to reach out if there's any questions on the valuation side.
Thank you, Curtis. And Blayne.
Yeah, I want to thank you, Rob, for putting this together, for managing these personalities for sure, and making sure that that we don't overtake the time allotment, don't speak over each other. I know that's sometimes a thankless task, but we appreciate it. And also to everybody that's listening, feel free to reach out to us three. If you need other experts in the industry, we have those relationships. We kind of set from a bird's eye view, if you will, and have relationships in most states for different types of professionals or to better understand the industry. We're very open to having those conversations. It might take us a few hours to get back to you, but do feel free to reach out to us, and we will respond and spend time trying to help you get answers to your questions. And if we don't have them, we'll know who to send you to.
Thank you, Blayne. Again, I want to thank you, Curtis and Steve, for taking the time to provide a wealth of information. I, of course, want to thank all the attendees who took their time to join us today. Really appreciate it. And again, if you have any follow-up questions or feedback, just as easy as clicking reply to any of the emails you received about the program and sending your questions and feedback along. With that, this concludes today's program. Again, thank you to our panelists for taking the time to share their insight. Thank you for all the attendees for joining us. I wish everyone a wonderful afternoon, and with that, this concludes today's program. Thank you.